everyone, let's talk about polycystic ovary syndrome, or PCOS for short. It's a condition that affects many women around the world, and understanding it can make a big difference in managing it. You might know someone with it, or maybe you have it yourself. It's more common than you might think, affecting about 1 in 10 women of childbearing age. Don't worry, you're not alone. There are many support groups and resources available to help you navigate this condition. PCOS is a common hormonal disorder that affects women. It can cause a variety of symptoms, including irregular periods, weight gain, and even fertility issues. Think of your hormones like a team. They need to work together to keep your body running smoothly. When one hormone is out of balance, it can throw the whole team off. PCOS happens when there's a bit of a mix-up with these hormones. This imbalance can lead to the development of small cysts on the ovaries, which is where the name comes from. It often starts during the reproductive years, but it can show up later too. Symptoms can vary widely from one woman to another. PCOS is a bit of a mystery. We don't know exactly what causes it, but we do know that genetics and insulin resistance might play a role. If your mother or sister has PCOS, you might be more likely to have it too. Insulin is like a key that lets sugar, or glucose, into your cells for energy. It's crucial for maintaining your body's energy levels. With insulin resistance, your body doesn't use insulin as effectively. This can lead to higher levels of insulin in your blood, which can affect your ovaries and lead to PCOS symptoms. Don't worry, we're going to break down everything you need to know about PCOS, from the symptoms to the treatments. Let's get started. Understanding PCOS is the first step towards managing it effectively and living a healthier life. So, what's going on inside your body when you have PCOS? Let's dive deeper into the details. It all starts with your ovaries, the small but mighty organs located on either side of your uterus. These little powerhouses are responsible for producing eggs and hormones like estrogen and progesterone, which play crucial roles in your reproductive system. These hormones are essential for regulating your menstrual cycle and maintaining overall reproductive health, ensuring everything runs smoothly. With PCOS, your ovaries might develop small, fluid-filled sacs called cysts, which can be a bit concerning at first glance. But don't let the word cyst scare you. These cysts are generally not harmful and are quite common among women with PCOS. However, they can interfere with how your ovaries function, potentially disrupting the normal process of egg release. This disruption can lead to irregular periods or even no periods at all, which can be frustrating and confusing. On top of that, PCOS can mess with your hormone levels, creating an imbalance that affects various aspects of your health. You might have higher levels of androgens, which are often thought of as male hormones, but women have them too, and they play important roles in the body. These hormonal imbalances can cause a whole bunch of symptoms, ranging from physical changes to emotional challenges, which we'll talk about next.
PCOS can be tricky to identify and manage because it affects everyone differently, making it a unique challenge for each individual. Some women might have mild symptoms that are easy to overlook, while others experience more noticeable and disruptive changes. Here are some of the most common signs of PCOS that you should be aware of. Irregular periods. Your periods might be irregular, infrequent, or completely absent, which can be frustrating and concerning. Acne. Ugh, those pesky pimples. Increased androgens can lead to acne breakouts, even in adulthood, making skincare a constant battle. Excess hair growth. You might notice hair growth on your face, chest, or back. This is called hirsutism and can be quite distressing. Weight gain. Many women with PCOS struggle with weight gain or find it difficult to lose weight, despite their best efforts. Hair thinning. On the flip side, some women experience hair thinning or hair loss on their scalp, which can affect self-esteem. Skin changes. You might notice dark patches of skin on your neck, armpits, or groin, known as acanthosis nigricans. If you're experiencing any of these symptoms, it's important to talk to your doctor. They can provide a proper diagnosis and guide you through the next steps. They can help you figure out what's going on and discuss treatment options, including lifestyle changes, medications, and other therapies to manage your symptoms effectively.
PCOS isn't just about your ovaries and hormones. It can affect your overall health in many ways. Here's the deal. PCOS increases your risk for other health problems like type 2 diabetes. Insulin resistance, a common issue with PCOS, increases your risk of developing type 2 diabetes. Heart disease. PCOS can affect your cholesterol levels and blood pressure, increasing your risk of heart disease. Sleep apnea. This sleep disorder, characterized by pauses in breathing during sleep, is more common in women with PCOS. Endometrial cancer. Women with PCOS may have a higher risk of endometrial cancer, a type of uterine cancer. It's important to remember that having PCOS doesn't mean you'll definitely develop these conditions, but it's crucial to manage your symptoms and make healthy lifestyle choices to reduce your risk.
Section 5. Taking charge of PCOS lifestyle changes. The good news is that you can take control of your PCOS and live a healthy life. Simple lifestyle changes can make a big difference. Maintain a healthy weight. Losing even a small amount of weight can improve your symptoms and reduce your risk of complications. Eat a balanced diet. Focus on whole foods like fruits, vegetables, lean protein, and whole grains. Get moving. Aim for at least 30 minutes of moderate intensity exercise most days of the week. Manage stress. Stress can worsen PCOS symptoms, so find healthy ways to manage stress, like yoga or meditation. These lifestyle changes might seem small, but they can have a huge impact on your health and well-being. Section 6. Medical treatments for PCOS. Lifestyle changes are the first line of defense against PCOS, but sometimes you might need a little extra help from your doctor.
Birth control pills can regulate your periods, reduce excess hair growth, and clear up acne. Metformin is commonly used to treat type 2 diabetes, but it can also help improve insulin sensitivity in women with PCOS. Your doctor might prescribe other medications to address specific symptoms, like hair loss or infertility. Remember, it's important to talk to your doctor about the best treatment plan for you.
Section 7. Taking a closer look. Diagnosing PCOS with histology. Now let's dive into the science behind diagnosing PCOS. Histology plays a crucial role. Histology is like looking at your body's tissues under a microscope. It helps us see what's happening at a cellular level.
To diagnose PCOS, doctors often look at a sample of your ovarian tissue. This helps them see if there are any characteristic changes, like the presence of cysts. Don't worry. Getting a tissue sample isn't as scary as it sounds. We'll talk about that next.
Section 8. Getting a sample for PCOS diagnosis.
To get a sample of your ovarian tissue, you'll need a minor surgical procedure called a laparoscopy. It's usually done under general anesthesia, so you'll be asleep and won't feel a thing. During a laparoscopy, the surgeon makes a small incision near your belly button and inserts a thin, telescope-like instrument called a laparoscope. The laparoscope has a camera that sends images to a monitor, allowing the surgeon to see your ovaries. The surgeon will then take a small tissue sample from one or both of your ovaries. This sample is sent to a laboratory for examination under a microscope.
Section 9. PCOS under the microscope. What do we see?
When the pathologist examines your ovarian tissue under the microscope, they're looking for specific signs of PCOS. These include multiple cysts, which look like fluid-filled sacs. The outer layer of your ovary, called the capsule, might be thicker than normal, and the stroma, which is the supporting tissue of the ovary, might be increased in PCOS. These microscopic changes, along with your symptoms and hormone levels, help confirm a diagnosis of PCOS.
Section 10. Hormone check. Understanding your lab results.
In addition to a physical exam and histology, your doctor will likely order blood tests to check your hormone levels. Here are some key hormones they'll be looking at. Elevated levels of androgens, like testosterone, are a hallmark of PCOS. Luteinizing hormone, or LH, is a hormone that triggers ovulation. Women with PCOS often have higher LH levels than normal, and follicle-stimulating hormone, or FSH, stimulates the growth of eggs in the ovaries. In PCOS, FSH levels are often lower than LH levels. Your doctor will use your hormone levels along with your other symptoms and test results to make a diagnosis.
Section 11. You're not alone. Living with PCOS. Being diagnosed with PCOS can feel overwhelming, but remember, you're not alone. It's a common condition, and there are many resources and support systems available. Managing PCOS is a lifelong journey, but with the right information, support, and treatment plan, you can live a full and healthy life. Don't be afraid to ask your doctor questions, connect with other women with PCOS, and advocate for your health. You've got this.